Good morning, everybody. Myself, JYOTI SRIVASTAVA. Today, I am here to share a topic living with COVID-19 as a teacher. A question that might come in the mind of everybody is why at all we as teachers are so much concerned about this COVID-19? Government is there looking after it, doctors are there looking after it. Then what is the use for us? Since COVID-19 has affected all the spheres of life, we cannot remain in isolation with this. We all are affected by it. So to my best of knowledge, I would like to discuss as a teacher in this session, what exactly is this COVID-19 briefly and how to live with it. It's not going to go this fast. So living with it has to be practiced by a common man. Now, let us first understand what is COVID-19. COVID-19 is the name given by World Health Organization (WHO) on February 11, 2020 for the disease spread and caused by novel coronavirus SARS-CoV-2. It started in Wuhan, China in late 2019 and has since then spread worldwide. COVID-19 is an acronym that stands for Coronavirus Disease of 2019, COVID is equal to COVID. Our concern is that our teachers also frontline workers. This is why we are taking up this topic. Otherwise, I would have never taken up this. Whether the school reopens today or maybe 1 month later, we are in direct touch with thousands of students, and as it is the Bible truth being said, teacher's verdict is taken as the statement of confirmation by students. So this is why we have students who trust us, who are coming from different backgrounds, who have different mindsets, and we are dealing with them directly. We are dealing with them directly. Therefore, to some extent, we can say, yes, we teachers are also frontline workers. There was a time when we said we are academic engineers. We are academic engineers. We deal with children, live human wires. You'll find a teacher can mold a child's future, can go for destroying also. And if we see a general awareness on hygiene, on discrimination, on social distancing, on public gathering, what we have shown in the diagram, we have taken up all the aspects. We have taken up all the aspects in this slide where the role of teacher is very important. We try to focus on all the fronts and ensure that the information is going to the core level of the society, whether it is regarding health services, regarding maintaining certain decorums of life. We talk about the elements of standard precaution that should be taken up in day-to-day life. In day-to-day life, as such also we should take, but normally people overlook it, and when the need of the hour says, we have to reinforce it by saying we are there to speak on it. So we are starting with that. The first one is hand hygiene, where how to wash hand, when to wash hand is to be made known to the people. Then respiratory hygiene in terms of various etiquettes that comes out. Then the common PPEs which are there according to the risk of your job profile. According to the risk of your job profile. If you're not dealing with public, you don't need to go for those detailed PP kits. But where, for example, a bank employee, customer dealing is there. For teachers, we are dealing with huge crowd. So for us, the element of risk would definitely increase. So we need to be well aware of it. Then safe injection practices, sharp management, and injury prevention. Awareness has to be there. Then safe handling, cleaning, and disinfection of the patients. Care equipments has to be seen. Then is your environmental cleaning. Ensure that your surrounding is properly being disinfected. Safe handling and cleaning of the soiled linen. And last but not the least, waste management. Waste cannot be eliminated from the society. But what is the waste disposable management system that you are going to take to avoid any casualty? This part, awareness has to be done. Now, the awareness campaigns that has been taken by various government organizations as well as non-government organizations involves basics of COVID-19 to be told, quarantine and isolation at individual level also, infection prevention through PPE, then psychological care of the patients with COVID-19. That is very important. Infection prevention and control, laboratory sample collection and testing system, clinical management of COVID-19, there is general management of COVID-19 and ICU care and ventilation management. Then come on to the safe precautions in terms of hand washing. There are various detailed campaigns being taken up. Earlier also it was being taken up in the hospitals, but now at all the public places it is being done. How to wash hand, how to sneeze and dispose of the handkerchief, social distancing, and taking care of old people. Taking care of old people in the society. We talk about the mode of transmission. Mode of transmission. And we say it is either through physical contact, droplets, or through sneezing, coughing. So if you see, we are showing how direct and indirect contacts through airborne particles are being transmitted. These are various routes, and we come to the next slide, which would further clarify that if the chain of transmission, what you could see in the slide is for an infection to spread, all the links must be connected, and if we are breaking any one of the link, we will stop the disease transmission. So this part has to be inculcated, imbibed in the people that break that chain. What best you can do is don't be a courier to it. Break the chain of transmission. Then coming to the next slide, that is on hand hygiene, do's and don'ts. right from a child of nursery to our colleagues itself. We need to make them aware how to use the liquid soap in between the fingers, how you have to rub, and splashing up of water properly with rinsing effect in bubbles. And do not ever touch your hands if it is infected. You feel you have touched something, your eyes, your mouth, your nose. Don't touch these things with your hand. Further, we elaborate because this is the biggest carrier. So I've taken 2 to 3 slides on this. While you are opening the doorknob, you are going for medication, you are using your cell phones, you are going with instrument handling, or you are going with other activities of taking care of the patients, your hygiene part, either with gloves, and if you're without gloves, all the more you have to be alert. Then how to rub the hands. If you go to any hospital, whether it is Max, Medanta, or others well-known hospitals, at every point they have displayed this thing how to rub and wash your hands, which you could see giving 20 seconds, 20 to 30 seconds, moving clockwise, anti-clockwise the way it is given. Try to practice it, and sooner or later you'll find it comes into your habit to rub it that way. Those who are in medical profession or in paramedical line, it is part of their course curriculum at the basic level itself. But now the demand of hour is we also should go for using these things as a matter of precaution. Now PPE for use in healthcare for COVID-19. If we see what are the instruments and what are the parts being taken care of. Head cover, which takes care of your head and hair. Goggles, which take care of your eyes. Face mask, which takes care of your nose plus mouth. Face shield, that takes care of your eyes, nose and mouth. Gloves, that takes care of your hands. Apron and gown, depending upon the requirement, they both take care of your body. And N95 mask for your nose and mouth. What you could see in the next slide in the form of pictures also, depending, like what you see, an apron and a gown, the difference between the two. Where you are going for extensive exposure with somebody who is infected, you need gown. While if you are simply into a normal working gesture, apron is always preferred. You can take anyone. These days, if you go to banks, offices, especially the personal department, finance department of an office, you'll find almost every employee, whether it is public sector undertaking or private, they are using face shield. They are using hand gloves. Along with that, they are using mask also. Now, the next slide, in a very critical manner, where we go for introspection, but above all our introspection, government's decision is final. Government's decision is final. Are the schools prepared? Yes or no? It's a matter of controversy where everybody have their own argument depending upon the infrastructure available, depending upon the scenario of the school, the strength of the school, and what support system you have. What support system you have. Because for students, we are dealing in a room with 40 to 50 students. And you don't know from which corner of the town which child is coming with what. It had been seen in some of the vocational courses, colleges. Students during their lockdown were enjoying vacation and they, when came, were tested positive for COVID. How is the school to be blamed for that? How is the school to be blamed for that? So we'll not like to go much, at least when it is a platform of public. But yes, it is a matter of introspection for every school, every organization, every person involved in the management of the school, that are we actually prepared? Then only we'll call students. Life safety is first. Academics can always be upgraded. This is my personal opinion. This is my personal opinion. We are carrying out with learning process. Our approach might vary. But we are definitely moving with it. Next question that comes down is, use of ICT for classwork is widely spread overall, but not universal. And the thing comes, are we prepared with it? Do you agree to it? No. We had been taken up ICT class, especially in the primary sections for rhymes and other things long back. It's not that this time under crisis we are starting it. We had been practicing it. The survey says 53% of the teachers let their students use ICT for project or classwork. So this is not something new that a teacher is taking up. We had been practicing. Only thing is, it was more feasible, practical for primary sections. Audio visual round is more for them. At +2 level when we are talking, the intensity was a bit less. I do accept it. But now, under the present scenario, we are taking up. We are upgrading ourselves about in next slide. That is innovation in teaching. Innovation in teaching. And the thing comes, do you agree to it or you disagree to it? We are going with, and you could see out of those 5 bulbs, 4 are blinking, 1 is a bit mild. So that says 4 out of 5 teachers say they strive to develop new ideas for teaching. Nobody wants to sit idle and have a banner of saying I'm continuing with the job. You want to give your best. So seeing the future of the student, every teacher in general, what we have said through the statistics, 4 out of 5 teachers say that they strive to develop new ideas for teaching. Now, always remember from where it started, and we cannot ignore it. That is Wuhan. And if we go with breaking up, W for wash your hands often. U, use mask properly. H, have temperature checked regularly. A, avoid large crowds. And N, never touch your face with unclean hands. Now, coming to this one part of my session, one part of my session, I'm concluding saying the best way of thanking, which is now globally accepted, is Namaste of our Indian culture. This is the first part of our discussion where we had taken up general awareness on COVID. Now, the second part that I am going to take up is for case study purpose. For case study purpose, which is more relevant with 12th Business Studies Management. 12th Management. How we take up points and we try to correlate it with various chapters, like we can always correlate with business environment, with principles of management, with your staffing when we are talking about retrenchment, with the share market being affected, we can always correlate with the financial market. We'll take a few points only, seeing the limitation of the time, that how these points you try to gear up for case studies. Definitely whatever is the latest would be included for the board exams in some or other form for case study. For example, when demonetization was a hot cake to be sold in market, almost whether it was the paper of economics or BST, you had a case study there. GST, it was being included in BST, economics, accounts, everywhere. So one activity which is affecting all the spheres of life would come in some or other form in that particular subject. So from business studies point of view, from management point of view, we are going to take up certain points and we'll have an open session later on how case studies have to be developed on this point. First is a nationwide lockdown since 25 March was dealt or has dealt a heavy blow to the jobs and the economy while triggering a massive reverse migration of workers from cities to villages. Employment affected. Companies forced to go for retrenchment. It was the biggest setback to the economy. And then it indirectly affected social part. Crime level increased. So you see there's a chain of circle being formed with one act of an organization. Next is, while India was managing to flatten the curve, was a good news. The fact is that unlike many other countries, even after the series of lockdown, the number of infections continues to rise, even at a declining rate. Maybe the rate is declining, but it is increasing. Not surprisingly, the government is now talking of living with the virus by taking various precautions like 2 गज की दूरी बना के रखिए while trying to restart economic activity. We cannot go for lockdown because that shows an economic recession on our economy. So we need to go for opening up, but with certain precautions. This is why living with COVID is an important topic which I personally felt has to be taken up. Next we come down. While lockdown gave India a breathing space to bolster its creaky healthcare system, set up more hospital beds, isolation areas, ventilators, etc., as the spread of infection was delayed by 6 to 7 weeks. There is a long way to go. Now this we spoke on the health sector of India, which was neglected for a very long time. And the only way to patch up was to prolong your lockdowns one after other to prolong your lockdown one after other. The Prime Minister spoke of how from not producing anything at the time of COVID-19, which struck us, India is now producing 2 lakhs N95 masks and PPE suits a day. This is a good news, but there is a long way to go when you consider that the country has 12 lakh doctors and 30 lakh nurses, each of whom requires one suit and one mask a day. It is true that not all the doctors and nurses are treating COVID-19 cases, but till India has a much wider testing protocol, and this requires adequate stock of working testing kits, including rapid antibody ones. Now, this part we can always use on the economic recession part, where we said with the lockdown there is a slowdown in the economy. Even in this, we had gone with a ray of hope, that was we had explored an opportunity for business producing kits, and not only for the consumption in India, even abroad. What we said, our basic concept of thali, diya, sab mil karke has uplifted our economy, and we are back onto the rails. But still, there is a warning on precautionary. Next, we see inducing behavioral changes regarding the usage of masks at all the public places. Washing hands frequently with soap, etc., will not only mean dis sorry, will not only mean intensification of awareness drive, but apart from the measures to enforce these, crucially, access to key resources has also to be there. Now, I have intentionally included one more topic with it, that is dealing with fears and stigmas. Which is very important because the psychological and the social part with people is very important to be dealt. So, with this, I would definitely like to go with thanking everybody for being with me, and all the information that I have taken up are from internet sources, and I'm expert, but I have tried to spread awareness as per my best capacity. Your suggestions are most welcome. It would further motivate me to come up with further videos of this type so that our teaching community, our students, our parents can be enlightened with the information. Thank you.
To him.